what that means is her kidney function, though still not normal, has improved by about 1/3.
Wow.
Which is remarkable. And I thought this was just, fluke or something. And I've tried it in several other diabetics since then, and have seen a very similar thing because, of course, kidney function is dependent upon blood flow. And if we can improve the blood flow to the kidney through changing the diet, kidney function often improves too.
That's a really big deal.
It's
Really
a real big deal.
Wow, okay.
Yeah.
So I'm sorry to have interrupted you,
Oh,
but
that's
these are
okay.
such good things. I want to make sure people
Very
understand.
good things. Very
Okay.
good things. And because the kidney is as old as it is, they really don't expect the life expectancy for a transplant to be more than 10 to 15 years. So we've done really well with keeping it going.
Okay.
So that's a real good thing too.
So when you went to see Dr. Howe, you didn't have pulses in your legs. There were some challenges with your kidneys. Tell me more about that first experience with him and what has happened since.
Well, actually, when I first went to Dr. Howe, it was over 20 years ago. So Dr. Howe's been caring for me for quite a long time. But some of these problems have come up as the years have progressed because type 1 diabetes has, some people get a lot of side effects from it, other people don't get the side effects. I, unfortunately, are one of those that have gotten almost all of them. But Dr. Howe has been very, very good. He's very conscientious. He follows everything really, very closely. He's very concerned about the good things, making sure things are...
And he put you on this RAVE diet.
He
What is
did.
that?
That is, RAVE stands for no refined foods, no animal fats, no vegetable oils, no exceptions.
Okay, that sounds like not a nose. What are you eating?
I'm eating a lot of good stuff. I eat a lot of fruits and vegetables. We eat a lot of things. My husband is very much into this too. He does a lot of the cooking. And he makes a lot of pastries, cookies and muffins and stuff. They have no fat in them and they have no sugar in them.
Wow.
And they're very healthy. They're made with whole wheat flour. We eat a lot of fruits, vegetables. I can eat pizza. We make our own pizza at home. We eat a lot of things. Stir fry, spaghettis.
So you started this diet. Your pulses came back. Your kidneys have improved. What else has happened to you since beginning this program?
I feel a lot better overall. I really do feel a lot better. For a while, after a while, my blood pressure went down, and we were able to cut back on some of my medications. And there was a heart medication I was taking. I don't have to take it anymore.
Wow.
And so that's been a big improvement too, not having to take so many medications.
So what I hear Deb and you, Dr. Howe, saying is that with a type 1 diabetes, following this different lifestyle, and it truly is a lifestyle, not exactly just a diet, that their experience can be improved.
Absolutely. We used to think that if we just control the blood sugar tightly, we would help prevent heart disease, coronary artery disease, which Deb also has. But there are 4 studies in the last year that have shown that really tight control actually causes more problems. And so there we're stuck. We still have people dying of coronary disease. Because of that, a bit of experiment with Deb and now some others, using a vegan, no-oil diet like Esselstyn and Ornish recommend, has made marked improvement. And I think it really is the answer for type 1 diabetics that have advanced disease or wanting to prevent it. Is it going to make them live forever? No, nothing will. All of us are going to die. But if we can improve things for a while, if we can get a normal life expectancy, if we can delay the onset of the eye problems, the amputations, which we've clearly done in Deb, it's worth it. It's just a change in the way you think. You start thinking of your food as medicine, as part of the treatment, and it makes a world of difference.
Very good. And Diane, You're our type 2 diabetic,
Okay.
and I believe you're a nurse.
Yes,
Okay, so you've been around this stuff for quite some time.
I was seeing myself become one of my patients.
Okay,
and I
you're
didn't
seeing
want
yourself
that.
become one of your patients. Wow. So how long have you been a type 2 diabetic?
About a year now. It's been approximately a year.
Okay.
And I was having trouble with my morning blood sugars being high, so I talked to Dr. Howe about it. And he told me about the vegan diet. I went on it, and I was so impressed with the results that I just couldn't, I almost couldn't believe it. I dropped my A1C from 6.6 down to 5.3 in just a matter of less than 4 months. So it
Which
was,
is normal. I mean, she's essentially made her diabetes go away.
And what you mean by A1C?
Hemoglobin A1C is a measure of how much hemoglobin has sugar attached to it. And we can back figure what the average blood sugar has been over the previous 3 months. Dropping it from 6.6, that would be considered good control in a diabetic, but her sugar was climbing. And her doctor, I'm not her doctor, I just work with her in the ICU. Her doctor said it's time for medication, and rightly so. But Diane decided, well, I'm going to use food as my medicine, and was able to drop her A1C or her average blood sugar into the normal range. Not good control, but into the normal range, which means essentially no diabetes.
Wow,
yeah.
that's a
pretty
big deal. So you went from having fairly decent blood sugars to having normal blood sugars
Exactly.
in 4 months.
Exactly.
Okay, so how did you do that?
I basically went on the same diet she did. Vegetables, fruits, whole grains, beans, and it's just amazing what it can do for you. I've been very impressed with it, very impressed. And you know, I see it every day in my job, so I see the results of people having an uncontrolled diet and uncontrolled diabetes, so I was extremely impressed.
Dr. Howe, both of these ladies are eating things that you don't normally think of a diabetic eating. How are they achieving these awesome results eating carbs? That doesn't make sense.
Well, you know, the people set up the diet sort of in opposition. We have the Atkins type diet, which is very low carb, and that will control the blood sugar because there's no carbs in it, but it causes real problems. And then you have high carb diets. So you have low carb, high fat, you have high carb, but no one really deals with what's important.